Hi everyone. So in this video, I'm going to give you a short overview of the readings in week 1 and why we've selected those readings and what is the message, the takeaway that we want you to get from this week. During the sync session, I mentioned that this course, we're pushing boundaries and we're hoping to get you to think a little differently, right? And so this is just an elaboration of what I introduced in the sync session itself. Now, you've all seen me, so I'm just doing voiceover here. I will also put this up as an audio file so that you can just listen to it and you don't have to watch it, okay? Now, what I'm going to do is to kind of walk you through the readings and highlight the main pieces in the readings itself, right? Now, the New England Journal of Medicine article, that's a very recent article that's come out, and they propose this notion of a cyborg and a centaur, right? A centaur being just these two different things coming together. Cyborg is more of a seamless integration, and using those metaphors, they talk about how clinical education should happen. And yes, this is in the context of medical education, they're talking about it. For me, what I liked about this article is the recognition that everyone is using generative AI tools in the clinical environment itself. Just accepting that is a very baseline thing we need to do now. We cannot bury our heads in the sand. They are using it. We can't say no to it either because there are advantages to it. So this article explores how can we have our learners use these tools appropriately and effectively. And so again, from a learner perspective, they then propose the DEFT AI model where they talk about discussion, evidence, feedback, teaching, and recommendations for AI engagement. But like I mentioned in the sync session, to me, this is very strongly grounded in human exceptionalism. The idea that the attending is the expert over here and they have all the answers and they will decide if what AI is providing is right or wrong. I'm okay with those things, right? But I just think AI, while they're thinking of AI with the notion of a cyborg, I don't think it goes far enough to incorporate AI into a realistic clinical environment, right? For an education scenario, this might work. But let's think about it. Our learners are not going to be learners all the time. We want to give them skills so that they can do this by themselves later. They're not going to have someone to report to all the time. So what we really want is for them to go through this thinking process by themselves and be able to justify what they're doing. The Lomas article on how AI is being used in healthcare, I thought is a really good article that brings in so many uses of AI in healthcare itself, things that you don't generally think about, but how AI is embedded in all the things that you do, right? And they do bring in education as well. So this particular reading is broader than just medical education or healthcare education, but just healthcare in general. And I think we need to take that view of it as well, right? And in the section on education, they do talk about the fact that we need to be moving more towards knowledge management rather than information acquisition. So I want you to just think about this, right? Our education system is built on a system that started more than 100 years ago. We're still following the same system. Okay, so what was it 100 years ago? 100 years ago, everyone did not have access to information. You didn't have a Google you could just pull up for to check something. You didn't have AI or you didn't have a smartphone that you could just immediately check and pull information on just in time whenever you needed it. 100 years ago, the information was in books, in libraries, and so it wasn't accessible. In the moment when a doctor or a healthcare professional is practicing, they needed to have that information in their head because that's the only place they could. You're not going to cart around books, right? Now we're using that same concept and we're still carrying it forward in an age when information is so easily accessible and there is an information overload because of how much of information is there around us, and we're still focusing on that, and we're still trying to say that our learners have to have all of this in their head. I 100% agree that there is some basic competencies and information that anyone should have. I will not trust a doctor who has to look everything up on his handphone. That won't work either, right? So I'm not saying that we shouldn't, but I think we need to find a balance, and we need to be teaching our learners the knowledge that is out there and how to critically assess the information that they receive. We have not done a good job of that till now. Google came, social media came, we didn't do a good job. We need to be doing a better job with AI because AI is way too integrated in what we do. So I liked that concept of knowledge management and information acquisition that this article brings in. The other section that I really liked is where they introduced this idea that the new roles for healthcare professionals, right? You now need to be an evaluator because you have to evaluate the technologies that you're working with. You have to evaluate it critically. And in the readings, they give you examples of where these technologies go bad, so bad that they're giving you wrong results, but we don't know, right? We're all conditioned now to think that if it is coming from an AI tool within my clinic, I will just trust it. Can we? Should we? Those are questions that we need to be asking and teaching. So we need to be evaluators. We need to be interpreters, right? We can't always assume that this information is going to be correct. It's not always provided in a manner that is easy for us to digest. We will have to take that information and contextualize it at some points. I was just talking to Dr. Severo just now, and he said, these tools don't know my audience. It'll never talk to my audience. That I need to do that. And that's what we need. We need an interpreter. And you need a good communicator as well. So these are new roles that our learners need, that we need as practitioners as well. And so what are the competencies? We need to have competencies of stewardship and advocacy. These are not things we are talking about yet. We are still in this position of questioning AI. Is it having hallucinations? Can I take this? I think that's too basic. We cannot be at that level anymore. That was 2023. We're at 2026 now. We should be moving way beyond all that. And so I really like the roles that the Lomas article set forth for us. And so I want you to think about that as you're reading that article. And when they're talking about evaluating and interpreting, I think the model, so the article Beyond Tools that I put forward is based on the epistemic entanglement framework that I generated, because I feel that we cannot be at augmentation, we cannot even be at integration, we need to be at co-agency, right? The article Beyond Tools itself is a very short commentary piece. It doesn't lay out the model in detail, and that's really not necessary for you, because in assignment 1 you actually practice it and you get a sense of it. What I want to say is the problem is we stay at augmentation. We keep thinking if we give the perfect prompt, it's going to give me a response that I can just take. No, I don't want to take that response. I don't want you to take that response. I want you to question the response. I want you to critically analyze that response. I want you to engage with the AI tool so that you can come up with something better, right? Which means you're now integrating, you're having a recursive interaction with it. And finally, the product that you come up with should be a co-constructed thing. The product is not just you, not just the AI, but it's the result of your connection together. And that you can really see in a clinical environment, right? You can have reports generated by AI for your radiology images and everything. It can give you ideas about it. It can give you the diagnosis, but you now need to critically engage with that, see if it works. Is this what we are going to? and then you come up with the final thing. So it's not a matter of just taking it as it is. And I think we're failing at that, or we just haven't come far enough there. And that's where we need to be going, right? And so we need a joint agency kind of movement when we're talking about our interactions with it. And finally, I love this Kelly article. And I'm a little saddened that there's not more literature in this area, because I really think this is where we should be going. But it is very difficult for us humans to give up control, because the model of pilots in an airplane cockpit, there is a lot of giving up my control to the machine and really working together with the machine. And that is a very difficult concept to accept, right? And I think medical education is struggling with that right now. But this article does a phenomenal job, because I like the way that they take the system perspective, right, about the safety issues, and that has to be a systemic thing that we do, but also at an individual level, how are we going to learn these skills? How are we going to interact? What are the new competencies that we need? So to me, the model of the pilot and the pilot training that we're doing is something that we should be thinking about and really considering as the next way of educating our learners. It's a huge jump. It's a complete paradigm shift, right? Now, will it work? Well, it's not going to work exactly as it does in the aviation industry, obviously. We're going to have to make changes. But there are some fundamental competencies that the aviation industry puts forward that we do have to think about. The way they take information from the AI tools, the way they are able to integrate it, but question it, and still be able to function without the tools, is something that we need to start thinking about and learning from. And I'm putting this forward to you all as something for you to think about, right? And like I said in the sync session, you don't have to agree with this. You could think of this as completely out of bounds thinking. She's crazy. That's perfectly fine. What I want is to put the notion out there for you to consider. And once you consider it, you can see whether it works or not. I have no issues if it doesn't work. I just want you to consider it. So that's where we are with week 1. And the assignment works with the epistemic augmentation, integration, and co-agency. It really is about just having a conversation with the tool versus coming up with a prompt. If you all have any questions, of course, please reach out and we can have a conversation about this.